There is a silent killer hiding in the chests and abdomens of over 2 million people right now.
It is a condition that often has no symptoms, no warning signs, and no pain. Until the exact moment it becomes catastrophic. It is called an aortic aneurysm. The aorta is the largest blood vessel in your body. It is the main trunk of the tree of life,
carrying oxygen-rich blood from your heart to every single organ and limb you possess. In a healthy person, this vessel is strong, flexible, and roughly the width of a garden hose. But for many seniors, specifically those with a history of smoking, high blood pressure, or a specific genetic predisposition, the walls of this mighty river can begin to weaken. They bulge out like a balloon that has been overinflated. This bulge is the aneurysm.
If this balloon bursts, it causes massive internal bleeding that is fatal in up to 90% of cases.
We often think that such a deadly condition would require expensive scans or invasive procedures to detect.
But there is a simple physical test, a test you can do right now with your own hand. In less than 5 seconds, that can reveal a hidden genetic clue regarding the integrity of your aorta.
This test involves your thumb.
It is known in the medical world as the Steinberg Sign.
And it tests for a specific type of connective tissue laxity that is strongly correlated
with a weakness in the aortic wall.
Performing this movement does not guarantee an aneurysm, but it is a massive red flag for your health.
That your collagen, the glue that holds your body together, might be too stretchy
to support the high-pressure flow of your heart.
Here is how you do it. Hold up your hand, palm facing you.
Fold your thumb across your palm towards your pinky finger.
Close your fingers over your thumb, making a fist.
Now look at the side of your hand, near the pinky. Does the entire tip of your thumb, specifically the nail and the joint, extend beyond the edge of your hand?
If your thumb is completely hidden inside your fist, that is normal. It means your tendons and ligaments have normal tension. But if the tip of your thumb protrudes significantly past the side of your hand, sticking out beyond the pinky knuckle, and this is a positive Steinberg sign.
This test measures hypermobility, or extreme flexibility of the joints.
Being able to stretch your thumb that far indicates that the connective tissue in your body is unusually long and lax. This laxity is a hallmark of systemic connective tissue disorders, specifically Marfan syndrome. Marfan syndrome is a genetic condition that affects the proteins that build connective tissue.
People with this condition often have long limbs and flexible joints, and crucially, a weakened aortic wall. Because the same defective collagen that allows your thumb to stretch so far is also used to build your aorta.
A positive thumb test suggests that your aorta may be more prone to stretching and bulging.
It is not a diagnosis of an aneurysm itself, but it is a marker of susceptibility.
If you test positive, you are statistically at a higher risk for aortic enlargement and dissection.
There is a second test you can do to confirm this finding. It is called the Walker-Murdoch sign, or the wrist test.
It tests the same principle of bone length and tissue elasticity.
Here is how to do it. Take your right hand and wrap it around your left wrist.
Use your thumb and your pinky finger to encircle the wrist. In a person with normal connective tissue, and the thumb and pinky will barely touch, or there will be a gap.
In a person with hypermobility or Marfanoid traits, and the thumb and pinky will not only touch, they will overlap significantly.
If your pinky covers the entire nail of your thumb while wrapping your wrist, this is a positive sign.
If both tests are positive, it is a strong indication that you should speak to a cardiologist immediately.
Specifically if you have a family history of heart issues or sudden death.
It means your body is built with a type of collagen that may not be tough enough to handle high blood pressure. While the thumb test looks for genetic risk, most aneurysms in seniors are not caused by genetics alone, but by lifestyle factors.
These aneurysms, specifically abdominal aortic aneurysms or AAA, often give physical clues that are ignored.
The most common sign is a pulsing sensation in the abdomen. Lie down flat on your back and place your hand gently on your stomach, right around the belly button.
Relax your stomach muscles. Do you feel a rhythmic, pulsating lump deep inside? In a thin person, it is normal to feel the heartbeat slightly. But if you feel a distinct, large mass that is throbbing,
it suggests that the aorta has ballooned out to a size where it is palpable through the abdominal wall.
This sensation is often described by patients as feeling like they have a heartbeat in their stomach.
Another silent symptom is deep back pain.
The aorta sits right in front of the spine.
As an aneurysm grows, it can press backward onto the vertebrae or the spinal nerves.
this causes a gnawing, constant ache in the lower back or the flank. Many seniors mistake this for kidney stones or just regular arthritis pain.
But if the pain is constant, not relieved by changing position, and feels deep and penetrating, it could be the aorta. We cannot talk about the aorta without talking about the single biggest enemy of vascular health: smoking.
Smoking is the #1 cause of abdominal aortic aneurysms. It is responsible for 75% of all cases.
Why is smoke so damaging to this specific vessel? Cigarette smoke contains enzymes, specifically elastase,
that actively digest elastin. Elastin is the protein that allows the aorta to snap back after a heartbeat.
When you smoke, you are chemically dissolving the elastic fibers. You are turning a rubber hose into a brittle paper tube.
The damage is cumulative. A senior who smoked for 30 years and quit 10 years ago is still at risk.
The structural damage to the elastin has already occurred. The destruction of elastin is irreversible. Once it is gone, and the vessel wall weakens permanently, causing the ballooning effect. The second great enemy is hypertension. Imagine a balloon. If you attach it to a high-pressure air compressor,
it expands until the walls become paper thin. High blood pressure acts as that compressor.
if you have untreated hypertension, specifically systolic pressure over 140, you are hammering the aortic wall. This mechanical force pushes against the weakened collagen and elastin, causing the aneurysm to expand rapidly.
Controlling blood pressure is the single most effective way to prevent rupture. You cannot afford to put high pressure inside a weak pipe.
There is a difference between an aneurysm growing and an aneurysm dissecting. A dissection is when the inner layer tears.
Blood rushes into the tear, separating the layers. It forces the wall apart, peeling it like a banana. The symptom is distinct. It is described as a tearing or ripping sensation in the chest or between the shoulder blades. It is sudden, severe, and migrates. It moves as the tear extends down the aorta. The tragedy of aortic rupture is that it is easily preventable if caught early.
The tool for detection is simple, painless and non-invasive: the ultrasound.
A healthy aorta is about 2 centimeters wide. If it is 3 centimeters, it is considered an aneurysm. If it grows to 5 or 5.5 centimeters, surgery is usually recommended because the risk of rupture becomes high.
With a positive thumb test or family history, advocate for this screening regardless of your gender. Can you strengthen your aorta through diet? You need nutrients that build connective tissue.
Nutrient 1, copper. Copper is the essential mineral required to create the crosslinks that hold collagen together. Eat copper-rich foods like liver, dark chocolate, cashews, and sesame seeds. Nutrient 2, vitamin C. It is the fuel for collagen synthesis. You cannot build a single strand without it. Nutrient 3, glycine bone broth is the best source, reinforcing the arterial wall.
Beyond diet, you must avoid activities that cause massive spikes in blood pressure, like holding your breath while lifting.
Focus on rhythmic aerobic exercise, like walking or swimming, which keeps the vessels flexible. The thumb test is a small window into a large truth. It reminds us that our bodies are connected.
If you try the test and it is positive, do not panic. It just means you have a specific physiology that requires care.
You have lived a long life of resilience. Use that resilience to protect the vessel that carries you.
Check your thumb, check your pressure, and protect your lifeline. Try the test right now and share your results.
Do not forget to like, share, and subscribe. Thank you for watching, and take care of yourself.